Dr. K, Dr. Kevin Kavanagh, is a retired physician and founder of Health Watch USA, and he is with us now. Dr. K, good morning.
Good morning, Jack.
Dr. Kavanagh is with us on Friday mornings, and we have him for 30 minutes then and take questions from our audience. And we had a question last Friday about Ivermectin, and somebody called in and said that's the go-to drug in Japan, and it's apparently a miracle drug, and why aren't we doing it here? And you totally candidly said, I'm going to have to do some research on that. You did your research, because you always do. What'd you come up with?
Well, things aren't looking as rosy as what was reported. The drug is being investigated. It's being investigated at Vanderbilt because it does have a antiviral effect, but as far as it being effective, in other words, enough to turn the course of the disease, that is not known. And the story was misquoted by Reuters. In other words, it wasn't the caller's fault, but Reuters really? Kind of misinterpreted antiviral effect, meaning effective. And those are two different things. The viewers have to realize that all of the drugs that are investigated have some sort of effect on the disease that they're trying to treat. But only about 1 in 100 are safe enough and effective enough to enter into the clinical market and be used in patients. So an investigative drug, although you may have 1 or 2 research articles which show good results, you still may have many that show it doesn't work well enough or isn't safe enough for use. So very few of these drugs will reach market. Now for me, I'm waiting for the results from Vanderbilt. And when you hear this controversy, it isn't whether or not ivermectin works versus it doesn't work. It's whether or not it works enough to use in patients now, or it's just an investigational drug, and the majority of those don't work in people. So I would be very careful on using ivermectin at this point. Let's wait for the results out of Vanderbilt. And believe me, if there was any earth-shattering results, I would think we would be hearing by now that, well, we had to stop the clinical trials early because this was just a miracle drug. And we're not hearing that. So let's hold our hold our judgments. Let's take the drugs which work and that have been approved by the FDA.
Makes sense to me. Tell us about the coverage of the University of Louisville on 60 Minutes.
Yeah, and if anybody thinks that I'm making this up or an alarmist, watch last night's report on 60 Minutes. And you can do that online. Google 60 Minutes. And during this report, they had a huge segment, about 12 minutes, on the University of Louisville. They described ambulances waiting an hour before they're allowed to be seen into the ER. And believe me, if you have a heart attack or you have a stroke, that hour is the difference between having a good result and having a bad result. They mentioned that 85% of the patients unvaccinated. These are patients that are hospitalized. So that's why I keep harping on get vaccinated, get a booster. We can't have our facilities overrun. Jack, similar to what you talked about last week, they said that once patients are admitted from the ER, they'll oftentimes have to wait days before they get a room. One of the ER charge nurses described how her usual staffing are 12 nurses in the ER. Now she's down to 9 nurses, and they're taking care of 71 patients with 16 in the waiting room. And again, they talked about staffing shortages. There was one day last month where 454 were off of work sick with COVID. Now, they weren't dying sick in the hospital, but they had contracted the virus and sick enough they couldn't come into work to take care of patients. Remember, patients are often immunocompromised. You shouldn't be taken care of by a sick physician. So this is really frustrating. And then on top of that, the doctors and nurses are describing retaliation against themselves by patients, sometimes being pushed, sometimes being cursed at. All of this because they're frustrated. Many of them believe this is a hoax. Why don't you have rooms? Why aren't you treating me? Are you discriminating against me? This is all made up. It's absolutely craziness. And Because of this, we are losing a lot of staff. Many of these staff will take years to retrain and get back. And I just think that it's a disaster that is unfolding before our eyes, which is one of the main reasons why people need to pitch in, help out, wear a mask, and get vaccinated so we don't overwhelm and essentially break our healthcare system.
Always great to have you on with us. Thank you very much.
All right. Thank you, Jack.